Hi, welcome to a new episode of Leadership Lessons, a podcast where we take a deep dive into the stories of inspiring leaders and entrepreneurs who have gone through a journey of reinvention and transformation in their personal and professional lives. My name is Yatin Naik, and I'm the business head of HT Smartcast, India's largest audio podcasting platform. On this podcast, we'll explore the habits and practices of these leaders that have helped them take risks, learn from their mistakes, innovate, and make change. So whether you're a seasoned executive or a budding entrepreneur, get ready to learn from the best. This is a special episode brought to you by Optum Global Solutions India. Today's podcast features a truly inspiring guest, Krishnan. She is the Managing Director India at Optum Global Solutions. Over the last several years, Uma has held senior leadership roles in India and globally, including board positions as an independent director across finance and commercial sectors. She has led transformational businesses and projects, including launching credit cards at one of country's largest private sector banks. But what is very interesting and intriguing is what she has done before turning to corporate career. She was a diplomat in the Indian Foreign Services. Uma's leadership stands as a shining example of agility, growth, and resilience. Hi Uma, welcome to Leadership Lessons. First things first, walk us through your career journey.
Thanks for having me here, Yatin. It's a pleasure. My leadership journey has been a privilege, and it's given me more opportunities than I could have ever imagined at the start. Did I start with a grand plan? Not really. But whatever I did, I had a few guiding principles. One, give it the best you can in whatever you do. Second, make a real difference, right? And third, don't be afraid to fail. So when I look back, I started my career with the Indian Foreign Service. I actually passed in the first attempt. Didn't expect to, but I did. And I think for me, that was a manifestation of the fact that you give it your best and you know what, you can do even the things you thought were impossible. For me, that was enabled by the fact that I grew up in an environment with very little bias. And genuinely, I could dream the dream I wanted without any boundaries and barriers. So I think that was my first lesson, which said, hey, you can do something. You don't have to be normal. You can be amazing. That's quoting Maya Angelou, who's one of my favorite poets. I then spent a few years in the Foreign Service, and it's an experience that I will cherish always. And then went on to do a MBA in IIM, Bangalore, and then started a corporate career. I've done many roles, both commercial and leadership roles, both globally and in India, across financial services organizations, technology companies, and more recently, I've joined Optum Global as the Managing Director India. So that's a very quick summary.
Interesting. So, but how did you get into healthcare with Optum? You know, that's kind of a unique segue into your career, right?
Yeah. I asked myself that question when I took the decision. So I think what resonated most for me with Optum was its mission.
Right.
Help people lead healthier lives and make the health system work better for all. Stepping back, I've been there some months now. Personally, I also felt that this was a journey I'd like to make because I had been in financial services for a long time. And I've always been driven by the need to grow, to learn something new, to take on something challenging. And healthcare to me, along with what Optum was doing globally, which is really impacting people's lives and helping them lead healthier lives, gave me an opportunity which I said will probably intersect my personal requirement or my ambition or growth goals along with the company's mission. And most importantly, this was very personal for me because I think post-COVID, healthcare has become more personal to me like it's become for all of us. So I think that kind of made the decision easier. And I'm learning about healthcare and I'm grateful for that.
Interesting. Can you talk to us more about Optum? You know, what is Optum doing? What are your key focus areas?
Yeah. Happy to share that.
Yeah.
So Optum, a part of United Health Group,
Okay.
it's a Fortune 5 company. It's a health services innovation company.
Right.
Optum provides comprehensive connected healthcare services across the healthcare systems. And that it does through 3 key business units. One is Optum Health, the second is Optum Insight, and the third is Optum RX. So very briefly, Optum Health provides comprehensive connected healthcare delivery platforms across the board, where it helps impact quality of care, the outcomes that the patient gets, and also at a cost that's a lower cost, right? Optum Insight provides research, analytics, management, consulting, and overall managed services across the healthcare system. And Optum RX provides pharmacy benefit management and pharmacy services. In India, Optum started in 2002, and we work across the entire spectrum of services. So for digital health, work in digital health, automation, product development, healthcare operations, analytics. So there's a team working in India supporting all of these areas. We also have a presence now in 5 cities, Gurgaon, Noida, Bangalore, Hyderabad, and Chennai. Deep talent, we expect to expand our capabilities and be a really high-value partner to the enterprise.
Interesting. So let me just step back a bit and now talk about healthcare as an industry. Like most of the industries with digitization, AI and all that, there are a lot of changes happening. What are some of the changes which are impacting healthcare and especially redefining the future of healthcare?
This is a really interesting topic, and I think a lot of movement, right? The change is also accelerating quite quickly. So fundamentally, I think the center of gravity of healthcare is moving away from hospitals into people's homes, or more personal, closer to you. And I think that was a convenience that happened, and I think that convenience is here to stay. As a result of this, the healthcare organizations are now investing very heavily in telemedicine, investing in remote and in-home monitoring devices, which can then enable data and accurate information from the patient to flow seamlessly back to the healthcare providers. Optum is actually helping support this. We are blending the virtual and the in-person care by creating this seamless connection between automated processes and the digital data, which is actually going to help the patients get better care whenever they want to. The second thing that's happening here, and there's a big uptick in mental health related challenges, and then the digital therapeutics around that as well. So that's another big area that's changing in terms of the healthcare space. The first one is what I would call consumer experience. Now, the tech-enabled, the informed individual today has complete access to researching whatever they want.
Oh, the Google doctors.
Yes, the Google doctors, right? And then you can go and find out what you want.
Exactly.
And you can decide who your provider is going to be, who your clinician is going to be, who your doctor is, when you want your appointment, how are you going to get informed about your appointments, and so on. So I think that entire consumer experience has brought home the fact, and as this more people use it, it's actually adopted even more, even by the people who originally might have thought technology, I'm not so sure. But this whole customer experience is changing. The second thing that's changing is the idea of wellness, right? All of us, right? I normally wear my little Fitbit or whatever that I wear, but today it's not there. But I think the idea of wellness, which is all of us are going in, finding exercise regimens, fitness regimens, health, diets, and so on, wearables, and using those to actually proactively share our health data with our doctors and people who take care of us. And I think that's going to then enable what I was talking about earlier, right? That digital flow of information quite seamlessly. And we're doing it fairly proactively to manage our own health. And the last big one I'll call out is the emergence and creations of digital platforms with full data interoperability with consent, which will then mean that I will then become responsible for my own health data, right? So it doesn't matter whether I go to provider A, healthcare provider A or B, but I'm happy for it to kind of create my own digital platform so I get the best healthcare at the time that I need it.
Very interesting. Now, obviously, the question would be like, where does Optim and you specifically come in the picture? Where, what are your key differentiators within these aspects that you spoke about?
The healthcare landscape or the health services landscape has a number of disconnected solution points. I think where Optum brings value, and in a very unique way, and we are quite uniquely positioned for this, is on one side, we actually have the technology and the analytic solutions, data technology and analytic solutions. On the other side, we have deep clinical expertise and industry expertise. And then you pull this together across our cross-industry relationships. And as a result, we're able to bring the whole ecosystem together in a way that can enable people to solve the big challenges, right? So if you look at, for example, on the actual value-based care delivery, right, which is a fundamental, important focus area for us, we are able to then provide the physicians and the clinicians all of the insights, the data, and the tools they need to be able to make the right clinical decisions. Right. On the other side, using the analytics and the data and the evidence, we're able to help the insurance payers make those decisions easily, right? So bringing the healthcare providers on one side, providing them the right tools, on the other side, the payers, the insurance payers. And we also globally work with 4 out of 5 insurance providers in the US, and we serve over 132 million people across the entire system, which is employers, state and federal governments, insurance companies, payers, life sciences organizations. So we touch the whole ecosystem.
Right.
We're also an end-to-end solution for insurance payers, right? So we actually provide them the technology, the ability to resolve their processes. Right. So we provide...
And all this is in India, right?
We support that out of India. We support a lot of these out of India. So if you look at it, we bring together the whole ecosystem in a way that's pretty unique. And on the other side, the consumer experience I spoke about. We're working on digital health, and therefore we are enabling the consumers to be able to experience their healthcare and connecting them in ways that were not earlier possible. I mean, simply put, what we're doing is not about creating one more app, right? It's about actually making the connections between the consumers and their care providers, between the insurance payers and the healthcare providers, and kind of connecting the ecosystem as a whole, right? So I think, and that's unique about Optum.
That's fascinating. So I'm going to now again just get on another aspect, especially since this is a leadership lessons podcast, okay? And this is our classic leadership lessons question. What is your leadership mantra? How do you, and in a context of the healthcare industry, what's your leadership toolkit for guiding the industry and the company into the future?
So let me pick, lessons over so many years. I've learned, I've grown, but let me pick a few, right? I think the first one, as a leader, one of the most important lessons I learned fairly early on is that you just have to get the right talent on board, right? You get the right talent, give them some audacious goals, and then as a leader, move impediments out of their way. Right? And that's not an easy one because there's investment in coaching, there's investment in learning, there's investment in making sure that you are genuinely moving ahead careers of the people and the best talent that you can get.
Right.
And I kind of have tried my best to do that, to say the right person and the right talent for actually taking the next leap forward, right? So that's been one. The second one I'll call out is culture. Right? We've all heard this, right? Culture can eat strategy for breakfast. So in real terms, what does this mean? Culture in a company is, in my view at least, about how the top few actually behave. It does not matter what you say. It matters what you say, but it's also about what you do, right? And I think for me, what I've strived to do is to build a culture that's transparent, that's authentic, where people are comfortable speaking up, it does not mean we all have to agree, but it's great to have the ability to be heard, right? The ability to speak up and have those conversations. And as a result of that, sort of make sure that everybody, you build that culture so you can be authentic and transparent and enable people to do their best, right? So that's been the second thing that I have really focused on. The third one for me is about, as a leader, you don't have all the answers,
right.
but
yeah.
you have the ability to read the trends, read the...
So true.
Yeah, and then say, okay, in that context, what does this mean for our company, our vision and mission? And then be able to come up with a simple vision that with which you can actually inspire people on why they should take that journey with you, right? And for me, the way to do that is really about connecting and communicating, consistently boring sometimes, which is because you're saying the same thing, which is here's our vision, but being able to authentically connect with people as much as we can, right? And I find that that authenticity and that connect has gone a long way in how I've moved this forward. The fourth one's an interesting, and maybe this is specific to me, because I've worked in many global organizations and across geographies. I feel that for global companies particularly, being aware of how you operate in a cross-cultural environment is vital to success. Because genuinely global, and today talent is global. They can be sitting anywhere, they can, if you want the best talent. And global talent comes in all kinds of packages, right? They're different, they think differently, they act differently, but they bring something that you want to the table. And I think it's to be aware of how you can be effective in a multi-generational, cross-cultural, environment. And sort of be self-aware of how your own filters can impact perceptions of people and events, but be completely empathetic to how you work in a global environment. And that's, I found, really worked for me. And the last one is something that I'd say, simply put, I'd say take a chance on yourself, right? Quite often people don't take a role or take a challenge because they feel they're not ready. And I think that's more relevant for women is my experience has been. But I'd say take a challenge,
get out of your comfort zone.
Yeah, get out of your comfort zone and challenge yourself. And I mean, it's also been written about in a book called Growth Mindset, in a concept way, which is what you have to continuously learn and grow and be curious. And nothing is going to stay the same, right? So if you don't want to learn and grow, you're going to be left behind. So yeah, I'll pick those 5.
True. And so true. And that kind of leads me to my next question is that, we have a lot of youngsters who watch the podcast. And obviously, a lot of them are looking at healthcare as a career option, How do you see that? And especially given the kind of changes that are happening, firstly, can one plan career in healthcare at all?
I think you can plan anything you want to, but my only thing would be be open to the opportunities that might come your way, right? Yeah. But I think healthcare is a great sector to plan a career in. Why do I say that? The growth and evolution of healthcare over the next few years is going to be a combination of people, the environment we're currently in, and the tools and technologies that we're going to be using, right? And I think there is a huge opportunity for us to actually come together, the best talent to come together to solve for how we can take on some of the most pressing problems in the way we manage global healthcare. So for anybody who's a person starting out, I'd say 2-3 things. One is if you're looking for something where you want to put the consumer at the center of your work and really make a difference to the outcome of that person. And health is personal, right? Okay, and if you're able to do that and you're able to make thoughtful decisions, compassionate decisions, and you feel that you've actually made something change for the better, it's a great place to be in. Secondly, if you're the kind, and this is an interesting intersect, but if you're the kind who gets really, really excited by cool technology, and you get really excited by saying, how can I use cool technology to solve complex problems? Again, that's healthcare. Because as I mentioned, digital is accelerating really fast. Analytics is going to drive a lot of how we actually do preventative health events, etc. So It's a great intersect for both areas. So depending on what you want to do, I think I'd really encourage people to think deeply about healthcare. And guess what? You can make a real difference.
Right. Very interesting. And that's a great note to end the talk. Thank you so much, Uma, for taking the time. This is really very interesting. Thanks much.
Thank you. Thanks, Yatin.
That's it for this episode. We'll be back with another leader and more such lessons next time. To listen to more such episodes, follow us on htsmartcast.com.